What do I think we need to do? I think we need to be sure that we provide choices to people. One of the first things that I talked about in the campaign was providing people more choices for affordable insurance. Letting people get into the same plan that we have as members of Congress, the federal plan that would give people buying power, the opportunity to get to what's hopefully a more affordable solution. We saw this with my small businesses all the time. They couldn't afford the health care plans that were out there for people. People wanted to get health insurance for their workers, but they couldn't afford to provide the whole range of services, from institutional settings with nursing care, to assisted living settings, to senior living environments where we're bringing in care, to home-based care, where people are living in the same family home they've lived in forever and have care come to them. We want to look at that whole range of solutions and figure out how to most effectively and efficiently deliver those types of care. In some cases it'll be in one place, in some cases it'll be in other places, but we want to start out with coming up with the best solutions for people, which to me means that they have choices about where they want to be. If they want to be in one setting or another, the patient has some choice in that, and then we figure out how we finance that. So that's the kind of thought process that I think we should be attacking this with, and that's the one that I want to take to the table as we go through this process. Different things. My father-in-law, who was an internal medicine doctor before he passed away, always told us, I want to be taken care of at home. It was a very clear message. I don't ever want to go to an institution. Whatever we have to do, I want to be taken care of at home. Well, a couple years before he died, he fell and broke his leg. He was post-polio, didn't get around that well anyway, broke his leg and had to be in a hospital bed for several months. We were able to access home care services in Hudson Falls, where he lived, and he was able to stay at home, and his wife and the family was able to take care of him and have a nurse come in and have other people come in and do testing and help him get through therapy to where he got back up and went back to work and went back to practicing medicine. So we lived through that home care world and saw it work. My father, retired, recently got involved with hospice, where he lives out in Missouri, and became a volunteer and is working, going from patient to patient over the last couple of years, working with people that want to be at home for end-of-life care. And he's not providing the care, but he's a volunteer that's helping facilitate that. We make that work. From all the studies, that people that are able to choose to be at home or in a less institutionalized setting, if that's what they want, and get care, the kind of care that you guys provide, we have better outcomes. And that's where we're trying to go. We know we're going to spend a lot of money in this country on health care, but we'd like to be getting some of the world's best outcomes for that. And I appreciate and applaud you guys that are in this room and all the people that you represent for the work that you do that is driving towards those better outcomes and to happier, healthier people on the back end.